now we move on to Paul Moulton from Isle of Man Television. Good afternoon, Paul. Fast am I.
Thank you. I think you probably guessed where I'm going to go with my question, the first one, what you said in Tynwald the other day about the complaints you've had from the public about these press conferences, about the number of questions and the repetitive series of them. And what I really want to understand is how many people write to you to make you say that? Are they all of one opinion, or are you getting a mixed flavour? And is this really something that you just don't like doing?
No, I want to do this, Paul, but it's important that when you get lots, and I'm talking about hundreds of people and feedback over the period, that we've been doing the same style for roughly a year. And if there's a way of improving it, making it more interesting to the public, then we have to listen to that. So I've asked the team, for example, we know that a third of people switch off the minute we go to the questions. Now that's disappointing to find that out. We need to know what can we do to reinvigorate these briefings to ensure that more people stay on listening, because some of the questions are outstanding and can give really good information to the public. But if you're losing a third of your audience, then we need to say, well, what can we do? And therefore, any feedback from yourselves on how we can improve the feedback to the public, because at the end of the day, we need to get our message out. We can't have people saying we're switching off at the end of this, and that's why we've brought in a mental health expert today. It's why we've got James doing a briefing tomorrow with frequently asked questions on the vaccination programme. It's really important. We've also upped the advertising with all of you on getting the message over to the public. So we need to look at ways of improving it. Yes, I've had not just a few, I've had lots of complaints, and we need to act to try and improve the situation.
You understand that a number 10 Downing Street presentation after Boris or whatever has said his piece, the same thing happens. It happens everywhere. Some people don't want to hear the questions. In fact, actually, weirdly, most people tell you they don't want to stay for the questions and then can actually tell you every question that's been asked. You understand that this is something that has to be seen, that you're not sort of manipulating how these things are going to be done.
Yeah, Paul, I've never manipulated. You all ask your questions. I never have a clue what you're going to say to me. And we always give you the best answer that we possibly can and in the time that we're allocated to be able to, respond. But equally, if we're getting swamped with complaints, we need to say, can we do it better? And that's all we're looking to do. We will be still taking questions from the media. It's can we do it slightly differently? And we'll look to see how we can do that.
Okay, and just to qualify this, hundreds saying they don't like it and any saying they like it? Or, what's the balance level on this?
The first person that has said, please don't stop the questions, is I received yesterday. Otherwise, it's all one-way traffic making complaints.
You understand this could be like the Emperor's New Clothes, though, isn't it? You only get people writing to you to tell you that. Other people on to us. I mean, all of us are getting the opposite view. That's what I'm saying.
Well, I get that, Paul, but... And if it was just the hundreds of messages I get, I might have ignored it. But when I asked our media team, do people switch off? And we've all got the technology. You can check for yourself. Do people switch off when it gets to the questions? And I'm told a third do. That is worrying. And that's something that we need to improve so that we can continue to get our messages over. So I'm not ducking questions from the media. More than happy for it to happen. But equally, just because we've done the same thing for a year doesn't mean to say it can't be reinvigorated to improve that audience participation.
Okay, actually, just to finish with, that means 2/3 are still watching or listening, which is actually fantastic if you think about it. Anyway, let's move on. For the doctor, what's the process for someone who tests positive on day 13? You've been mentioning this. How do they get released? Of the link cases, do we know the breakdown of how many isolating and how many were not? And do we adjust our contact tracing and risk level assessment accordingly?
Well, I think there's several doctors on Zoom at the moment, Paul, but I take it you mean the Director of Public Health, so we'll bring Henrietta in on that.
Yes, multiple questions there. I'm not quite sure I follow all the threads. First of all, if somebody tests positive at day 13, they go on for a further 7 days of self-isolation, and then they're released without a further test at day 21. And the reason for that is partly related to the Kent variant, because there is emerging evidence there that the period of infectivity goes on longer with Kent than it did with some of the other variants. So therefore, erring heavily on the side of caution, because we are still aiming to get back to local elimination, we take them as being still infective at day 13 if they have a positive test. And in fact, where we have the CT levels available for those also support that a lot of those cases would still be infectious. So that's why they go on for another 7 days. Beyond day 21, the evidence is that any further positive PCR is likely to be persistent shedding, which is not likely to be infectious. Now, it's always possible that a tiny percentage would still be infectious. So by letting them go kind of automatically at day 21 without a further test, we're really balancing the need to protect the population from inadvertent release of somebody who might still be infectious against the burden of prolonged isolation on individuals. Okay? Now, you'll have to recap the other questions because I've lost the thread of them.
Of the linked cases, do we break down how many were isolating and how many were not? And do we adjust our contact tracing and risk assessment accordingly?
The linked cases now are all people who were identified as high-risk contacts and therefore were self-isolating. So therefore, there is nothing to adjust in terms of the contact tracing there, other than to extend their period of self-isolation.